welcome to the deep dive. I'm ready to jump into another interesting topic, looking closely at the sources you sent over.
Great to be here.
Today we're tackling canine and feline pleural effusion.
Ah, yes, it sounds quite technical. And, well, it involves a fair bit happening beneath the surface.
It really does. So our mission today is to take these materials and really unpack what pleural effusion is in dogs and cats. We want to understand, the many causes.
Here are quite a few.
And how vets figure it out, how they diagnose it, and what the treatment looks like. Basically pulling out the key info, making sense of it all.
Like charting a course through some complex medical territory.
Exactly.
Oh.
Okay, so let's start right at the beginning. What is pleural effusion, fundamentally?
Well, at its most basic, it's just an abnormal buildup of fluid, specifically in the pleural cavity.
And that's the space around the lungs, right? Inside the chest.
Precisely. Normally, there's just a very small amount of fluid there, sort of like lubrication. Pleural effusion means there's way too much.
Okay, so like a fluid traffic jam where things should be flowing smoothly. Why does that happen? What goes wrong?
The sources explain it as an imbalance, really. It boils down to either the body making too much fluid in that space or it's not draining it away properly.
Supply and demand problem.
Kind of, yeah. And there are a few core reasons why this imbalance happens. Changes in, say, blood pressure within the vessels.
Hydrostatic pressure.
Right, hydrostatic pressure.
Yeah.
Or changes in protein levels in the blood, that's oncotic pressure. Or the vessels themselves might become leaky, more permeable. And sometimes the lymphatic system, the drainage system, isn't working right.
Got it. So multiple potential breakdowns in the system. And when this fluid builds up, it obviously impacts breathing.
Oh, absolutely. The respiratory system is hit hard. And the cardiovascular system, too, because it's all connected in the chest.
And does this affect dogs and cats differently? Or certain types?
Well, both species get it, but the reason why they get it, the underlying cause, that often influences, if certain breeds or ages are more susceptible.
Okay. So the fluid starts accumulating. What are the signs? What would someone notice in their pet that might signal this is happening?
The big one, the most common sign, is difficulty breathing. That's dyspnea.
What does that look like?
It could be really rapid breathing even when resting. That's tachypnea. Or maybe they stretch their neck out and seem to breathe easier in a certain position. That's orthopnea. In really bad cases, you might see them breathing with their mouth open, which isn't normal for cats especially. Or their gums might get a bluish tinge cyanosis, which means they're not getting enough oxygen.
Those sound really urgent.
They are definitely red flags. Other signs might be a bit more subtle, like they just don't want to exercise anymore, or they're really lethargic, maybe off their food, sometimes a cough too.
And how severe it looks depends on.
Yeah, the sources say it depends on how much fluid is actually there, how fast it built up, and of course what the underlying problem is.
Right, and then the vet examines them. What physical clues might they find?
Well, they'll likely see that difficulty breathing, often shallow and fast breaths. But a key thing is listening to the chest.
With a stethoscope.
Exactly. The heart sounds and the lung sounds might be really muffled, almost silent, especially lower down in the chest where gravity pulls the fluid.
Ah, so the fluid blocks the sound.
Pretty much. But you might still hear clearer sounds higher up, dorsally. And sometimes if the vet taps on the chest, percusses it, it sounds dull over the fluid instead of resonant like it should over air-filled lungs.
Okay, that makes sense. So you've confirmed there's fluid. Now comes the really tricky part, right? Figuring out why it's there. The sources list a lot of possibilities.
They really do, and they helpfully group them by those mechanisms we mentioned earlier. So one big group is when there's just too much pressure pushing fluid out the blood vessels. High hydrostatic pressure.
Like what kinds of conditions?
Think about things that cause fluid backup. The classic example is congestive heart failure, or CHF, especially right-sided heart failure in dogs, even potentially giving fluids too aggressively intravenously.
So the system's overloaded, pressure builds, fluid leaks. What about the flip side? When the blood isn't holding on to fluid properly?
That's usually down to low protein in the blood, specifically really low levels of a protein called albumin. Hypoalbuminemia.
Okay.
Albumin creates what's called oncotic pressure, which kind of sponges fluid into the vessels. If albumin gets very low and the source is stress, it usually needs to be really low, like less than 1 gram per deciliter.
That low? Wow.
Yeah, quite severe. If it gets that low, fluid isn't held in the vessels as well and can leak out. This can happen with diseases where the body is losing a lot of protein.
Like through the gut.
Right, protein-losing enteropathy. or through the kidneys, protein-losing nephropathy,
Yeah.
or if the liver is badly diseased, since the liver makes most of the albumin.
Okay, so low protein means leaky vessels. Then there's this third big category, which seems like a catch-all for other circulation or drainage issues.
Yeah, the sources call it vascular or lymphatic abnormalities. It's a broad category, covering problems with blood vessels, the lymphatic drainage vessels, or just physical disruptions in the chest.
And this includes infections and cancer, right?
Definitely. Things like infectious causes. Pyothorax is a big one that's basically pus in the chest cavity, usually from bacteria, sometimes migrating grass seeds, things like that. And neoplasia cancer is unfortunately a very common reason.
Cancer originating in the chest or spreading there?
Both. It could be a tumor starting right there, like mediastinal lymphoma or a thymoma or mesothelioma, which affects the lining, or it could be cancer that started somewhere else and spread metastatic disease.
The sources specifically mention chylothorax under this category. What exactly is that?
Ah, chylothorax. That's a specific type where it's not just general fluid, but lymphatic fluid, called chyle, that leaks into the chest. It often looks milky.
And what causes chyle to leak?
Well, that's another whole investigation. The sources list a surprising number of potential causes. Sometimes it's problems the animal is born with, affecting the lymph vessels, like lymphangiectasia, but it can also be caused by things that increase pressure, like CHF again, or blockages in major veins, like the cranial vena cava.
So similar causes to other effusions sometimes.
Sometimes, yes. Also neoplasia, various fungal infections, even heartworm disease in dogs, or physical things like a diaphragmatic hernia or a lung lobe torsion, even trauma. It's a long list for chylothorax.
Wow. So finding chyle doesn't immediately tell you the root cause.
Not at all. It just tells you what type of fluid it is. Other things listed in this big category include diaphragmatic hernia itself, usually after trauma, where abdominal organs slip into the chest.
Okay.
Then there's hemothorax, which is just straight up blood in the chest, most often from trauma, but also bleeding disorders, coagulopathy, or even a specific lungworm, angiostrongylus in certain areas.
And lung lobe torsion. That sounds nasty.
It is. A part of the lung actually twists on itself, cutting off blood supply. That can definitely cause fluid, often bloody fluid, to build up. And even diseases seemingly unrelated, like severe pancreatitis, can sometimes trigger inflammation, leading to pleural effusion.
Goodness. That is quite the list of potential culprits.
Uh-huh.
It really hammers home that finding the fluid is just, step one.
Absolutely. The real work, the detective work, is figuring out which of these many possibilities is the actual cause in that specific patient.
So how do vets start narrowing it down? What clues do they look for first?
Well, the history and the physical exam findings we talked about provide some initial pointers. For instance, if there's a clear history of recent trauma, you're immediately thinking hemothorax or maybe a diaphragmatic hernia.
Makes sense.
If the animal has a fever, that points more towards something inflammatory, maybe an infection like pyothorax, or sometimes certain cancers can cause fever too.
What about heart signs?
If the vet hears a heart murmur or detects an arrhythmia or sees distended jugular veins in the neck, that obviously pushes cardiac disease way up the list.
And what if there's fluid elsewhere, like the abdomen? Ascites.
Right. Concurrent ascites is another clue. It suggests something more systemic. In cats, it makes you suspicious of FIP, feline infectious peritonitis. Or it could be those conditions causing widespread fluid shifts, like that severe hypoalbuminemia. Or sometimes CHF can cause both abdominal and chest fluid, though that's more typical on dogs.
Any other specific clues from the exam?
Yeah, the sources mention a couple. In cats, if the front part of the chest feels less compressible than normal, that can suggest a mass in the cranial mediastinum, like lymphoma or thymoma.
Something physically taking up space.
Exactly. And certain changes in the eyes can also be praetors for specific diseases like FIP or systemic fungal infections.
So many little pieces to put together. What about blood tests and urine tests?
Standard lab work, CBC, biochemistry profile, urinalysis is always important. It gives a picture of overall health. The CBC might show signs of infection or inflammation, maybe anemia if there's bleeding, or abnormal cells suggesting cancer.
And the chemistry panel?
That's where you'd confirm if the albumin is really low, hitting that less than 1 GDL mark we discussed for hypoalbuminemia. And in cats, checking globulin protein levels is key. Very high globulins, especially what's called polyclonal hyperglobulinemia, is a big red flag for FIP.
Okay, so the blood work gives systemic clues. But it seems like the most crucial diagnostic step involves the fluid itself.
Oh, absolutely. Thoracocentesis draining the fluid is essential, both for relieving the immediate breathing difficulty and for getting a sample to analyze. Sending that fluid off to the lab is critical.
What do they look at in the fluid?
A whole range of things. First, just its physical appearance. What color is it? Is it clear, cloudy, milky, bloody? Does it smell? Does it clot? Then, lab tests on the fluid itself measure the total protein concentration, the number of cells, sometimes pH or glucose levels.
And then looking at the cells under a microscope. Cytology.
Yes, cytology is huge. Examining the types of cells present in the fluid provides incredibly valuable information.
So how does that help differentiate the causes?
Well, the sources describe different classifications of fluid based on these characteristics, and each type points towards different underlying disease processes. For example, a transudate.
Okay, what's that?
That's typically a clear fluid, very low in protein and cells. Finding a pure transudate usually points towards problems with those pressures we talked about, either hydrostatic pressure, like early heart failure, or very low oncotic pressure from severe hypoalbuminemia.
Got it. What if the fluid is a bit thicker or cloudier?
Then you might be looking at a modified transudate. It has a bit more protein, a few more cells. You can see this with slightly longer standing pressure issues like later stage CHF, or sometimes with certain cancers or hernias.
Okay, and then the really inflammatory ones?
Right. Those are called exudates. These are high in both protein and cells. Finding an exudate tells you there's significant inflammation or infection happening.
And you can tell if it's infected.
Yes, that's a septic exudate. This is typically what you see with pyothorax. It's often thick, maybe yellowish or brownish, sometimes has a foul odor, and crucially, under the microscope, it's packed with neutrophils, especially degenerate ones, basically pus cells, and you can often see the bacteria themselves.
Wow, so seeing bacteria confirms infection right there.
Absolutely. And the sources mention some specific pointers for cats here, too. Things like high LDH levels in the fluid or a very low pH below 6.9 strongly suggest pyothorax in cats. Also, low glucose in the fluid compared to the blood glucose level, even if the pH is normal, can sometimes be a sign of malignancy in cats.
Interesting nuances for cats. What about the other specific fluid types, chyle and blood?
Right. Chyle, as we mentioned, often looks milky white because it's rich in fats, specifically triglycerides. Finding that confirms chylothorax, and then the hunt begins for why the chyle is leaking.
And blood.
Hemorrhage, or hemothorax, is obviously red. The fluid will look like blood and contain lots of red blood cells. This points towards trauma, a bleeding disorder, or maybe a bleeding tumor. If the pathologist sees macrophages that have eaten red blood cells, that suggests the bleeding isn't brand new, it happened a little while ago.
It's amazing how much information is locked inside that fluid sample. Are there other specific tests beyond the fluid analysis?
Yes, depending on what the initial findings suggest. If FIP is suspected in a cat, specific coronavirus tests might be run. Tests for feline leukemia virus, or FIV, are often done too.
Makes sense.
If heartworm disease is possible, especially in dogs in endemic areas, a heartworm test is needed. If pyothorax is confirmed, the fluid should be cultured to identify the bacteria and see which antibiotics will work best. For chylothorax confirmation, comparing triglyceride and cholesterol levels in the fluid versus the blood is key.
Okay, what about imaging? X-rays, ultrasound.
Imaging is definitely crucial. Chest X-rays or radiographs are usually the first step to actually confirm there's fluid present and get an idea of how much and where it is, one side or both.
Does that help narrow things down?
It can. Some conditions like chylothorax, pyothorax, or hemothorax often start on one side, though they can become bilateral. But the big challenge with X-rays before draining is that the fluid itself can hide everything else.
Right, like fog obscuring the landscape.
Exactly. So the sources strongly recommend, especially if the patient is having trouble breathing, to perform thoracocentesis first to remove the fluid, stabilize the patient, and then take X-ray.
Oh, so you can actually see what's underneath.
Precisely. After draining, you can properly evaluate the heart size and shape, look for lung abnormalities, check for masses in the mediastinum, evidence of a hernia, or signs of trauma like fractured ribs.
That makes perfect sense. What about ultrasound?
Ultrasound, or echocardiography if focusing on the heart, is also really valuable. It's often recommended if you suspect heart disease, a hernia, or a mediastinal mass. Sometimes it's actually easier to see certain things before draining all the fluid, as the fluid can create an acoustic window for the ultrasound waves.
Interesting. So the timing depends on the situation.
Yeah.
And the procedures themselves.
Well, thoracocentesis, the fluid drainage, is the main one. It's both therapeutic, provides immediate relief, and diagnostic, giving you that vital sample.
what if you still don't have an answer after all that?
In some tricky cases, if the cause is still unclear, more invasive procedures might be needed to get tissue samples, like biopsies. This could involve exploratory chest surgery, a thoracotomy, or using a minimally invasive camera, thoracoscopy.
Okay, so let's say you've gone through this whole detective process, signs, clues, labs, imaging, fluid analysis, and you've hopefully pinpointed the underlying cause. How do you actually treat pleural effusion?
Well, the very first immediate step is almost always that thoracocentesis. You have to remove the fluid to let the lungs expand and relieve the respiratory distress. Many of these pets are quite sick and need to be hospitalized for intensive care initially.
But just draining the fluid isn't a long-term solution, right?
Absolutely not. The sources are very clear on this. Preventing the fluid from just coming right back requires treating the definitive underlying cause. Draining buys you time and makes the pet more comfortable, but it doesn't fix the root problem.
So the treatment plan is entirely dictated by the diagnosis.
Exactly. If the effusion is due to CHF, the treatment focuses on managing the heart disease diuretics, heart medications, etc. If it's pyothorax, it involves aggressive antibiotics, often based on culture results, and usually requires repeated chest drainage, maybe even flushing the chest cavity or placing chest tubes.
What about things like hernias or cancer?
If it's a diaphragmatic hernia, surgical repair is necessary. For neoplasia, treatment depends heavily on the type and location of the cancer. It could be surgery, chemotherapy, radiation, or palliative care. For chylothorax, you try to manage the underlying cause if one is found, but if it persists, sometimes complex surgery like ligating the thoracic duct is considered, though success isn't guaranteed.
You mentioned diuretics for CHF. Are they used for other causes of effusion?
Generally, no. The sources caution against using diuretics, like furosemide, unless the effusion is specifically caused by a condition involving fluid retention or volume overload, like CHF.
Why not? Wouldn't they help dry up the fluid?
They might reduce fluid volume overall, but if the underlying problem is, say, inflammation causing leaky vessels or a tumor blocking drainage, the diuretic doesn't fix that. Using them inappropriately can just lead to dehydration and electrolyte imbalances without addressing the real issue, potentially making the patient worse.
Good point. Any other medication precautions?
Yes, the sources warn against using drugs that could depress breathing or significantly lower blood pressure, as these patients are already in a fragile respiratory state.
This all sounds incredibly serious.
Yeah.
What's the typical outlook for pets diagnosed with this? The prognosis.
Monitoring treatment response is vital, often involving repeat x-rays to see if the fluid is accumulating again. That tells you if the treatment for the underlying cause is actually working.
Are there other risks or complications besides the breathing difficulty?
The biggest risk, sadly, is death from respiratory failure if the fluid can't be controlled or the underlying disease is too severe. One less common complication mentioned is something called re-expansion pulmonary edema. Sometimes, if a very large amount of fluid that's been there a while is removed very quickly, the lungs can suddenly re-expand, and this rapid change can sometimes cause fluid to build up within the lung tissue itself. It's another form of respiratory distress. But overall, regarding the expected course and prognosis, well, the sources state it's highly variable depending on the specific underlying cause, but frequently it's considered guarded to poor.
Guarded to poor. It doesn't sound very optimistic.
It often isn't, unfortunately. They referenced one study specifically looking at 81 dogs with pleural effusion. In that group, only about a quarter made a full recovery. And depressingly, about a third either died or were euthanized relatively soon after diagnosis.
Wow, only 25% recovery in that study. That really underscores how pleural effusion is often a sign of something very serious going on underneath.
It really does. It highlights why finding that underlying cause is so absolutely critical.
So, bringing this all back to you, our listener, why is digging into this important? Well, whether you own a pet or just interested in this field, understanding pleural effusion helps you recognize those really critical breathing signs that should never be ignored.
Definitely. Time is often crucial.
And it gives you a real appreciation for the complexity of the diagnostic process, doesn't it? It's not just one blood test. It's this whole sequence of detective work history, exam, labs, imaging, and, as we've really seen, that incredibly informative fluid analysis.
It truly is a journey. The what, the fluid, is often obvious, but the why takes digging.
It shows how finding the root cause is everything for effective treatment. It's a puzzle.
And it's fascinating how that fluid sample itself, the effusion, holds so many of the key pieces to solve that puzzle, guiding the entire investigation towards the underlying disease and the right path forward.
A puzzle where the fluid provides the map. Well, that wraps up our deep dives into canine and feline pleural effusion. Thanks for joining us on this exploration.
Considering the sheer breadth of underlying causes we've discussed, everything from heart failure, infections, trauma, parasites, to numerous types of cancer, isn't it quite remarkable how examining that fluid, just the fluid accumulating in the chest, can give such specific, powerful clues to potentially pinpoint the exact, often very serious condition responsible?
It truly is a powerful diagnostic window hidden within the fluid itself. Food for thought. Until next time on The Deep Dive.